is Youre, your student nurse. For today's video, I will be showing you how to properly assess the head and the neck of the patient. But before we start, let me show you the equipments that we will be needing for today's assessment. So without further ado, let's start.
Good day, sir. This is Youre, your student nurse from Southwestern University, Finma. So for the verification, sir, may I know your name po?
My name is John Fritz Adalid.
How about your birthday, sir?
My birthday is February 6, 2000.
Okay. How old are you po?
I am 21 years of age.
So I'll just explain this procedure to you po, sir. So the purpose po of this assessment is to determine if the patient is currently experiencing any symptoms or has a previous medical history related to the head and neck issues. So I will be assessing your head, your eyes, your ears, your nose, your mouth, and neck. And for me to be able to assess that, I'll be able to touch certain parts of your body, specifically from your head down to your neck. Is that okay with you, sir? Okay, thank you, sir. So rest assured that all the documents and findings of this assessment are completely confidential with me and the attending physician that I will be referring you to. So, sir, do you have any questions or clarifications? So, what language is comfortable to you, sir? Is it Tagalog or English po?
Tagalog and English.
Okay, so before I start, sir, I'll just have a quick history about you. So, are there any lumps or lesions on the head or neck that do not heal or disappear?
No.
No? So, how about bukol or mga masas po?
No.
Wala naman po. So, how about difficulty in moving your head and neck?
No.
Hirap po ba kayo move ito?
No.
Okay, how about sa facial or neck pain po? Meron po ba kayong mga frequent headaches?
Wala po.
Okay, so nahihilo po ba kayo minsan or nawawala ng malay?
Wala po.
Okay, how about sa past history naman tayo, sir, no? So, is there any previous head or neck problems?
Wala po.
How about trauma or injury po?
Wala po.
Sa family history po, meron po ba sa family niyo na meron or nagkaroon po ng head or neck cancer?
Wala po.
How about family history of migraine and headaches?
Wala po.
Okay, so sa social naman tayo, sir, no? Sa lifestyle and health problems po,
Wala po.
nag-smoke po ba kayo or nag-gym
Hindi
po
po.
ba po? Okay, do you wear hat or helmets po?
Yes po.
Okay, very good. So, how about sa pagtulog niyo po? Ano po yung typical na position niyo kapag natutulog?
Nakatagili.
Okay, nakatagilid. So, ano naman po yung type ng recreational activities na ginagawa niyo po during your free time?
Nag-play ng mobile games.
Okay, how about mga physical activities po?
Meron po.
Ano po?
Basketball po.
Basketball?
Badminton.
Okay, sir. I'll perform the assessment na po. But before that, I'll just have a hand hygiene po. I-close ko po rin muna yung curtains to provide privacy for you po. So, assuming that I already closed the curtain to provide some privacy for the patient, and I'm also done doing my hand hygiene, the next thing that we will do is to put on the clean gloves first. Okay, I am now done wearing my gloves. So, for the first part of our assessment po is i-inspect ko po yung face nyo and ipapalpate ko po yung head nyo. Okay lang po ba yun? Okay, so I'll just palpate your head with my two hands po. Okay, sir, I will just inspect your scalp po. Can you please turn around? Okay, sir, so I have observed that your head is symmetrical, it is round and it is erect. Your head is in midline also, and you are normocephalic, which means that your head is normal. Your head is also appropriate in your body. Also, I don't see any lesions, scars, or masses in your head. There are no parasites like lysis po, yung mga puto po, and I haven't observed any alopecia. So, for the next one, sir, I will be checking your facial symmetry po and your facial movement. So, I'll just observe. Can you please look at me right in the eye po, sir? Okay po. Okay, thank you, sir. So next one, sir, I will be checking your cranial nerve number 7, which is the facial nerve. So please do the things that I will tell you to do. So can you please raise your eyebrows po, like this? Okay, down po. Okay, sir, can you frown po, like this? Can you smile po? Smile. Okay, can you close your eyes slightly po? Okay, sir, can you blink your eyes? Okay po, again po. Okay, sir, puff po yung cheeks natin po, like this po. Okay, sir, thank you po. That's very good. Okay, that's very good, sir. So, I have observed that you have an oval face. Hindi naman po ako nakakita ng abnormalities na ginawa niyo po yung facial expressions. So, sir, I didn't see any drooping of the face. Pantay naman po both sides ng face nyo. Okay, so the next one, sir, I will be palpating your temporal artery. So, allow me to touch you once again. Okay, sir, can you please bite your teeth like this po? Close your mouth po, and clench your jaw. Okay, sir, the next one, I will be checking your temporal mandibular joint. Open your mouth po. Close your mouth po. Open your mouth po, again. Okay, thank you, sir. Okay, sir, that's very good po. So, as what I have observed, I haven't seen any swelling or any kicking po. And your temporal artery is elastic and not tender. Nung ginawa ko po ba yun, sir, yung temporal mandibular joint, saka yung temporal artery, nagkaroon po ba kayo na any tenderness po? Okay, good. So, hindi naman po, no? Okay, that's good to know, sir. So, for the next part, sir, I will be assessing your eyes po. So, let me just check your eyes po, sir, ha? Okay po, thank you po. So, your eyelashes are evenly distributed, and you also have a thick brow, sir, and your eyeballs are symmetrically aligned, and your bulbar conjunctiva is clear, moist, and smooth. Your pupils are round and it's centered in the iris. Normal naman po ang mata niyo, sir. So, next po, sir, I will test the accommodation of your pupils. Please focus on this pen light po as I will move it closer to your eyes. As what I have observed, sir, your pupils constricted and your eyes converges, and this is normal. The next part of our assessment is to check the red reflex using an ophthalmoscope. And assuming that we have already done the procedure, the normal red reflex is easily visible, and the red area should appear round with regular borders. Okay, let's proceed with the next part, sir. I will be checking your visual acuity, so please read the chart, sir. Read the first line po.
E,
About the second line.
T, L, F, E, H, O, L, C, F, D, H, J, B, S, E, P, T, Z, O, C, F, D, H, J, L, E, F, P, H.
Okay, sir, so you were able to read it clearly po. So the normal distant visual acuity po is 20/20, and the normal near visual acuity naman po is 14/14. For the last one in the eye assessment, we will do a confrontation test for your gross peripheral vision po. So, ganito po, sir, gagawin po natin. Sundan niyo lang po yung direction po ng kamay ko po. So, can you please cover your eye po in this side? Okay po, can you see this po? Okay, sir, on the other side naman po. Okay, thank you, sir. So, while doing the assessment po, were you able to follow my hand po ba?
Yes po.
Were you able to see my hand?
Yes po.
Okay, thank you, sir. So, we will now proceed to the next part, which is the ear assessment. So, is it okay to touch and assess your ear, sir?
Sige po.
Okay, sir. So, I will now start inspecting your ear po. Just inspect your ear, sir. So, I have noticed, sir, that your ears are equal size and it aligns with your center of the eye po. So, for the next part po, I will perform an otoscopic examination po. So, I will start palpating your ears po. Pero po ba, sir? So, based on our examination, I have noticed that your ear has a small amount of cerumen or ear boxer and the color is yellow, which is normal naman po. So, wala po kayong dapat i-worry po. And next po, we will be doing the whisper test. You just need to repeat what I have whispered while covering the other side of your ear that is not being tested. So, is that clear, sir?
Yes, yes.
Okay, can you please cover your left ear po? And repeat what I've said po.
Hello.
Your other side po?
Hi.
Okay, that's very good, sir. Okay, sir, so you were able to repeat what I have whispered, and that is very good. So for the last part of this assessment po, we'll perform the Weber's test and the release test. Okay, sir, let's start po with the Weber's test. So sabihin niyo lang po sa akin kung saan niyo po naririnig, kung sa left side niyo po ba, or sa right side, or kung both po. Okay, sir, paano mo start? So saan niyo po naririnig yung vibration, sir? both sides. Okay, so for the next one po, we will perform the release test. So, i-activate ko na po yung tuning fork, sir. So, sabihin niyo na po sa akin kung nawala na po yung sounds. Okay, sir, upon performing the release test po, may narinig po ba kayo sa air conduction?
Yes po.
How about sa bone conduction po?
Yes po.
Okay, thank you, sir. So, based on our test, narinig niyo po yung vibrations on both ears and that's normal po. So, wala naman pong abnormality sa inyong ears and we will now proceed with the next part of our assessment. Okay, sir, the next part that I will be assessing is your nose po. So, let me inspect your nose po if you will allow me, sir. Okay, sir, so based on my observations, same naman po ang color ng nose niyo as the rest of your face, and your nasal structure is smooth and symmetric. Wala naman pong any tenderness. So now I will proceed in checking your frontal and maxillary sinuses. So I will just hold your head up. So both of your sinuses po is non-tender and crepitus are evident. So now I'm going to one of your nose juicers and i-ask ko po kayo kung nakakahinga po ba kayo ng maluwag, sir? Okay, sir, breathe po. So, okay naman po. The next one po. Okay, that's very good, sir. So now I'm going to check your internal mucosa po. So as I have observed, sir, your nasal mucosa po is dark pink, moist, and free of exudate. So the nasal septum is also intact, and there is no signs of ulcer. Yung turbinates niyo po are dark pink, moist, and free of lesions. For the next part of our assessment po, I will now okay, your lips naman po are smooth and moist without lesions. And complete naman po ang teeth nyo. And there are no decayed areas and isn't thick. Yung color ng gums at cheeks nyo are even. Also, yung tongues and ducts nyo are visible with flow of saliva. So the next one, sir, I'll palpate in your temporal artery. So allow me to touch you again. Okay, sir, can you please bite your teeth like this po? Next one, sir, I'll be checking your temporomandibular joint. Open your mouth po. Close po. Open po again. Thank you po. Okay, so very good. You haven't seen any swelling and any leaking. Your temporal artery is elastic and non-tender. Next po, I'll be checking your tongue again. Can you please open your mouth po? So your tongue are pink, moist, moderate lang din po ang size when properly present. No lashes are present. Your ventral surface is smooth, shiny, and slightly pale, which is normal. Your frontal lobe is in midline po, and wala po ako napansin na swelling, redness, ulcers, or nodules po. Okay, so yung last part naman ng assessment natin is yung sa neck part po. So I'll be checking your neck po, and I'll be observe your neck first. Okay, sir, so can you please look up po? Move to the side po. No. The other side naman po. Okay po, no? Straight po, yung face. Okay. Thank you po. So, okay sir, can you please take a sip of a small amount of water po? And hold niyo po muna yung water po. Hold niyo po muna yung ilong. Okay sir, hold niyo po muna yung ilong ha. Okay, look up po. Okay sir, pag-swallow na po. Okay sir, so I can see po that your trachea is in the middle line. And long muna po kayo. Okay lang po yung movement ng neck nyo and your thyroid cartilage and preferred cartilage is moving upward symmetrically and that's normal po. Didn't see any bulging or any swelling pagdating po sa ating neck part. Nung nagsipo kayo ng tubig, nakaroon na po ba kayo ng bara Or any tenderness sa neck niyo po?
Hindi po.
Any pain po?
Hindi po.
Okay? So, hindi naman kayo nagkaroon ng trouble sa pag-swallow po? Okay, that's good to know po. So, the next part, I'll be checking your cervical vertebrae posteriorly. So, pwede po bang tumalikod po kayo? So, I didn't see any irregularities naman po nung ginawa niyo po yun. And the next naman po na i-check ko po is yung range of neck motion niyo po. So, can you please look at the right po? To the left po. Okay, can you look to the ceiling again po? Down po. Okay, balik niyo na po sa normal. So, you don't feel any tenderness po ba yung ginagawa niyo po?
Hindi po.
How about, para po sa lalamunan?
Wala po.
Okay, that's good to know, sir. So, next po, papalpate ko po yung lymph nodes niyo posteriorly. So, can you please, so, the first one po is your preauricular nodes. Okay, sir. Okay, the next one po is your post-auricular nodes. Okay, your occipital nodes po. Okay, sir. Now, we'll check your tonsillar node. Okay, I will now check the submandibular node. Okay, I will now check your superficial node. Okay, I will now check the submental node. Okay, sir, I will now check your deep cervical node. Your posterior node na po. Last is the supraclavicular node po. So, there is no enlargement or tenderness present po. Next one, sir, I will be palpating your trachea para malaman ko po kung may lymph po. And, okay, sorry. Swallow po, swallow po, sir. Okay, papalpating ko po yung thyroid na po, sir, ha? Swallow po. Okay po, I can see that your tracheal rings are working po and maganda po ang pag-swallow nyo. Also, your trachea is in midline naman po. So now, I'll be auscultating your thyroid gland po. I will ask you to move your neck po ha. So, pwede nyo po bang, okay sir, I will now auscultate your thyroid gland po. So, mag-inhale po kayo kapag nilagay ko na po itong bell. Inhale po. Hold your breath po. Okay, exhale po. Inhale again po. Okay, thank you, sir. Okay, sir, so the landmarks are in midline and there are no enlargements naman po. So now, I will ask you to move your neck po. Pwede na po bang i-touch yung chin niyo po sa chest niyo like this po? Okay, up po. To your left po. Shoulders po, to your left. Okay, to the right po. Okay, sir, tumingin po kayo sa taas. Okay, thank you, sir. So, I have noticed that your C7 is visible and palpable. I could see that your neck movement is smooth and controlled with a 45-degree flexion, 55-degree extension, and 40-degree lateral abduction, and in 70-degree rotation. So, that is all for our head and neck assessment today, sir. So, maganda naman po yun nangyari sa ating mga assessments. Wala naman pong abnormalities po tayong nakita. Everything is normal po. So, thank you so much for your cooperation, sir. If you have any problems, kindly state it to our attending physician po that I will be referring you to. And that is all for today, sir. And see you in our next assessments.
Thank you.